This is the Change Physician, episode 178. Welcome back to the Change Physician. What does that look? Welcome back to the Change Physician. I am Melissa Cady, the Challenge Doctor, with my co-host, Dr. Kevin Cuccaro. And today, we've had some good conversations about, some of the things that have to do with choosing careers or jobs, or we had talked recently about location and lifestyle and money. And then we realized that there are some real downsides to people who, and not that there's anything wrong with it, but there's definitely some downsides to be, aggressively trying to achieve FIRE, financially independent, retire early. Did I say that right?
Financially independent, retire early. Yes.
Yes.
Yeah.
And I think that the conversation actually taps into a lot of potential, not always obvious consequences. Many times we equate money with happiness. And I think most of us, as we get older and get wiser, we realize that money doesn't always buy happiness, and that sometimes we, along the way of accruing that money, especially in the realm of physicians, we are kind of trading our time for money. And so that time used to try to acquire more and more money and focus on that, we can sometimes neglect other things in our lives. So did you want to make any comment off of that, Kevin, or would you like me to share some ideas I have?
You can share some ideas.
Okay, well, these are my initial thoughts about this, is that whenever we make money our focus, and many times tasks or being away from home are required to achieve those things, a lot of times relationships can suffer. It's not very uncommon for physicians to get divorced. Not just once, maybe twice, maybe thrice. Is that a word?
Thrice is a word, yes.
So the thing is that we end up, in order to be successful at making money the priority, sometimes we're not nurturing the very relationships that we had already acquired, and they're not getting the type of attention that they deserve. And unfortunately, the reality is, and there's a lot of, I guess you can call them studies, but there's a lot of evidence that relationships are a big component of people's overall happiness. We've talked about the blue zones and, community and relationships, and how that's an integral part to people's lives, and what is one of the highest priorities for people as far as what gives them satisfaction in life. So unfortunately, through working really, really, really hard and trying to retire early, people change over time. And so our relationships, unfortunately, are affected. And when we get a lot of gratification off of working really, really, really hard, the time spent in other areas, such as our relationships, are usually suffering, and you're not growing with that person and communicating in a way where you're really connecting and spending quality time together. Now, granted, there are relationships that can, survive over that, despite all of that. But I think it's not just relationships that suffer. I think of people who are churning and burning all the time, and they're creating this pattern of the same thing, really, just staying busy trying to make money, that they lose their hobbies. We've talked about this before. So if people are striving to retire early and they just hit the brakes and they finish, and they didn't have anything else they've been maintaining from a hobbies or relationships standpoint, you can't expect that this is just going to be a natural transition. Like, your nervous system has been driven into this pace, this fast pace, typically, of always filling your time with work. And that sudden stop is incredible. It creates, I think, a dissonance for a lot of people. And if they don't have a plan, and they're not the kind of person that can just fill their time with a lot of things that they like and have kind of built that into their life, most of their lives, then I think people set themselves up for failure. Many times go back to work, whether part-time, full-time, because they may not know what to do, and they lost their relationships and they want satisfaction in something. And we get a lot of gratification out of achieving. Many physicians do. You kind of have to, in order to go through all the hurdles we've had to go through to get to where we're at. But any thoughts on that?
Yeah. So I think a lot of it comes down to, there's dangers in two angles, right? And a lot of it has to do with, this is like the theme, awareness and intentionality, right?
Mm-hmm.
So if you're you're so focused, and we're saying fire here, but really it's just focusing so much on money. Because the first example I wanted to kind of bring up is the one where people are like, oh, I'm so burned out, I hate medicine. All I want to do is leave, and so I need to make a bunch of money in fire. So now you're saying that you're burned out, you hate your career, but you're going to work extra hard in this environment that you hate and are unhappy in, so that you can make the money, so that you can leave it. So you're essentially killing yourself,
yeah,
for this projected downstream something, right?
Mm-hmm.
And then the other ones is I think closer to what you were saying, where it's the focus on the money, period. Like maybe they don't necessarily hate medicine or hate the environment or whatever, but they're so focused on this goal. Like, I mean, this is a weird one. Like a lot of the physician groups are all focused on like 10 million. I'm always like, did you ever figure out like what your spend is? Like, because that's a lot of money.
Yeah.
But they're, oh, I got to do this, I got to do this, I got to do this. And anytime you're so focused on a singular aspect, of which money is simply one, and there's an argument in many scenarios that is not the most important, particularly in our country. When you're an industrialized nation, we have, you're a highly compensated professional or whatever. Like you said, everything else goes down. For someone who's focused purely on the money side and is not necessarily trying to escape medicine per se, but just really is focused on this goal, and then they're going to, I don't know, live on a yacht or something. Mm-hmm. The cost, like you said, is to your relationships, to your health, to your interests. And for the person on the other side is like, we're trying to do it because they're trying to escape medicine. That one just makes no sense to me, because you are really leveraging the fact, you're leveraging your health, all aspects of your health, your physical and emotional health. And I think that is profoundly dangerous. I was kind of interested because you mentioned about the divorce rates. So this is sort of off topic just a little bit, but I had to look it up because I'm like, okay, well, actually, what is the rate of divorce with physicians? And interestingly, we actually have, we tend to divorce less.
Do we?
Yeah. So there was a study in 2015, and of the respondents, 24% of them had been divorced. And then 25% of dentists, 31% of healthcare executives, and 30% of nurses are divorced. And overall divorce statistics, I think, are somewhere around 51%. So physicians in general tend to have a lower rate of divorce as compared to others, which I kind of find is kind of interesting.
It's counterintuitive to me, but maybe just because I've been divorced.
Well, yeah. And so maybe that's a more awareness, but I do, if you're a physician, and mine is skewed on this too, because I'm a physician couple. So I can see where with that shared experience, like being married to a physician, they like, I guess there's probably less resentment maybe if someone was focusing purely on career, because they would kind of understand that whole
acceptance of,
they know what it is, right? People, well, how come you're, I don't know. Well, I don't know how people are married to a non-physician, to be honest. It's like, well, you're never home from me. Yeah, I honestly don't get it, because it's, I don't know how people could, I'm one of those weird people that really, I don't truly understand it until I've actually experienced it.
Yeah.
And I know if I was not a physician, I was married to a physician, I'd have a hard time, because I just wouldn't, they could say it and I could say, I understand. I wouldn't understand like exactly what it's like, but
I don't think it would have worked in my training. I think it works okay now.
Yeah. Well, because it's different and you're not doing that high volume anything, but certainly if you're married to a non-physician and then you're purely focused on the money, well, and if they love you and they're not just interested in your money,
that's the other thing.
They may actually just encourage you, keep working, keep working,
so I can do my own thing.
But I've just have never really understood that, and I think I may have talked about this in a previous episode. Is people focusing so much on the money for a future that doesn't exist
Or not promised.
or not promised, or you may get there and it may not be anything that you like. It just seems crazy. I mean, if you hate medicine or if you hate your job right now, the reason we did this podcast is because there's so many options that you have as a physician. So find one of them.
Yeah.
Maybe you make less, but you can be happy doing it and you can have this life. And then you're not leveraging your current time which is really the only thing that exists, for this future that doesn't exist yet. And when you finally get there, may not even be the same. Like I think about the pediatrician who was going to retire in like a year and ended up having small cell lung cancer and was going to be dead in 6 months. I just can't even imagine, oh, on that date, 10 years from now, I'm going to fire. Well, at 9 years and 364 days, you find you have inoperable brain tumor, and you've leveraged all this time and this anticipation for a future that doesn't exist and now is never going to exist.
Yeah.
I can't see anything more tragic than that. So, I have nothing against, financial independence is key. Being financially astute, having a baseline understanding of basic finances. I think all physicians have. Most of us don't. But if you're only looking at it, you're just like this. I need to make whatever. I need to have 5 million before I retire, or 10 million before I retire, and I have to grind this much until I get to this date. I just find that so short-sighted and so dangerous, and that tunnel vision can really cause, what if you end, like you said, if you get to the end and then all of a sudden you don't have anybody, no relationships, no spouse, no kids, relationships, nothing. Is that kind of the future that you want, even if you got $10 million in the bank or whatever?
Yeah. Well, and it does take some, I feel like I'm at that time in my life where it's like you really examine yourself and realize, what parts of you can be better, in a way more of just like really enjoying things outside of work, and exploring things for, your own happiness and what makes you tick and what you may never have explored before because you're so busy training. But I wanted to make a comment off of that. You're saying about working really hard because you're just not happy in medicine, so you can get out of medicine, and how that's actually, I was thinking it's a self-fulfilling prophecy, because you are double timing into a thing that's already burning you out and is just going to burn you out faster, versus like reeling it back and slowing it down, and maybe going part-time or pulling out doing locums, and you say yes or no when you want. And the funny thing is, you can enjoy medicine, and not everyone, but people can enjoy medicine better sometimes when they just have more breathing room. It's like sometimes parents just need some breathers. They're better at being a parent if they can get away for a little bit, or they can go take care of themselves for a little bit and have more patience. And I'm not a parent, but I have plenty of people around me that I hear this. And you can see it in them. Like, it's, to me, whatever you are consumed by and putting in an inordinate amount of time, as much as you may love it or love him or her or your children, you are still human and you're not a robot. And there's a part of you that's maybe yearning for some downtime. And I think it's healthy. And so I think we have to have that awareness and intentionality to create that space. That's the thought I wanted to mention.
I completely agree. And I do think there's those two kind of diverging points, is if you're so focused on money, like, because there's some people who just they're just the pure workaholics. Yeah. But then at the end, after 30, 40 years of practice or whatever, when they're transitioning out for whatever reason, if you have no relationships, maybe you don't have a spouse, maybe you don't have if you did have kids, you have no relationship with your kids, your entire social net is your work friends who you are now exiting from. Mm-hmm. Well, I guess you could practice forever, because there have been physicians that, they're practicing into their 80s or 90s. And if that's the case, do it with intention. Yeah. But I guess the real tragedy one, though, is just the ones I see all these posts of these new physicians who are You're like, oh, I'm graduating this year and I hate medicine. It's like, okay, no, what you may hate the environment that you're in. You may hate, your training program that you're in.
Yeah.
But there's so many like, I guess, like, dig down, why did you go into medicine? And then recognizing you have all this debt and stuff, but you also, one of the things that you have is some time. And when you have graduated, particularly if you've graduated and you've finished residency, and if you get your boards, get your initial boards for sure, the flexibility and opportunities that you have, you're gonna be able to put bread on the table. Like,
Yeah.
you may not be able to buy a Lamborghini, and I've never had a Lamborghini, but I have no desire to have a Lamborghini, and hopefully, there's really, it's just crazy. And then, you kind of look at these incomes, and I think people get so, well, I have all these debts and I need to make all this money. Well, okay, you're gonna have those debts. That's cool, but you can still have your life. And it'd be interesting to see, like, you set this arbitrary dollar amount of about 10,000.
Mm-hmm.
What I noticed in our life was, once we made over about 120,000,
mm-hmm.
it wasn't a big difference.
Right.
Like, so, under, when we had 2 kids and we were paying for childcare and we were residents, that was tough. No, but once we kind of hit that threshold,
mm-hmm.
And then we had some big jumps, particularly when we were in San Diego, and those big jumps were not paired with big jumps in life satisfaction. Like, and that's, the studies say that, the data says that.
Yes.
My experience, like, as I said, once I experience it, that's like the biggest thing. And so if you're really struggling here and you really dislike medicine and you're so focused, I need to fire. I watched all the physician blogs and they're saying this, and I need to buy all this stuff, and I'm just going to work. And in 5 years, I'm going to do it. Dude, take a step back and figure out how much you actually need,
mm-hmm.
and what that buffer zone is. And then take a moment in time and just kind of figure out, well, if you're making 200,000 more, are you 200,000 more? Like, okay, so you're 100 to 200,000, maybe that's 200% increase in income. Are you 200% more happy or satisfied with it? My suspicion is you're probably not.
Right.
Yeah.
And if you don't allow yourself to be in the higher bracket, there's certain cutoffs for, like, even contributing to a Roth. Like, you could start off slowly and then, like, be eligible to contribute to your Roth as you're young and take advantage of the benefits over time. And as you move on, you could make more money and then be in a different bracket. And I don't know, there's just so many pros and cons to either way. But I think
you don't have to be so focused on this external dollar amount,
yeah,
that you have to have by a specific date.
Right.
You don't, and you can still be, don't have to be that focused on it, but you can still be financially savvy. You're going to make enough. You can there's a good chance you're going to be able to max out your retirement accounts. And I would totally do that. Like, and that's,
man, I wish I did. That was
the smartest thing we did was, as soon as we were in practice. Well, I shouldn't say that, because my wife was in practice for a year when I was in fellowship. And I'm not sure if I don't know if we maxed out ours, but after that we did. And, when you're looking at your overall salary, do it. Because it's not generally a huge proportion of it. And it's pre-tax dollars anyway. Max that stuff out and let it freaking grow. For first 5 years, if you're maxing that out, you're not going to end up with, whatever these people who want 10 million. And I know it's funny. People ask them, what are you going to do with that? And then there's no reply. It's like 10 million. That's
it sounds freeing, I guess, to some people, but you made a comment about people just coming out of their training and bitter and jaded out of their training programs. And I think you always have to step back and just ask yourself, what are the parts about medicine you love? And then reconstruct an environment that falls in line with that. Otherwise, you're just going to remain bitter if you feel like you have to do this because you have the debt, and you don't see anything outside of this little tunnel that you live in. And so I think that you can still, like you said, there's so many opportunities for physicians, And we want people to realize and be aware that there's so many communities out there that can kind of help you see things from a different angle, and how you can maybe create a few. I mean, you could be a consultant and doing locums and doing like the creative aspect of designing your life with the ability as a physician, and to use the top part of your degree and whatever you're doing, and realize that you can be independent and you don't have to be employed. You don't have to feel like you're under somebody. I mean, there's so many different ways of designing it and what you're comfortable with, that, you know, that you can, essentially, you're kind of like not making money the priority. You're creating your life around it, so you're not miserable, but yet you'll still accrue money and make money. But, you know, the focus obviously is the dangers of being financially independent, retire early, and if you're ignoring everything else in your life. And there was something I wanted to ask you, because you had mentioned this before we went on air, about the fear-based aspect to some of this, and just like your thoughts about how you just said, like, you make that 10 million, you know, what are you going to do with it? But maybe that's based and rooted in fear of, or not just unhappy in medicine or whatever, but
Well, yeah.
What's your take on that?
I think there's a lot of fear. So on the opposite side of this, if we're focusing so much on the whole fire thing,
Right.
there's the people who never want to retire, or delaying retirement because they're so scared of something.
Yeah.
The example I just heard about has to do with healthcare, right? And for me, always is like, okay, the smartest healthcare plan is to take care of yourself. Is that a perfect guarantee? No. Can you still die of a heart attack? Sure. Can you get some weird cancer? Absolutely. Yeah. But if you focus on those fundamentals of really staying healthy diet, healthy movement, healthy relationships, stress reduction, sleep, you know, that's the best healthcare plan that you have. Yeah. And to stay in a job because you're scared of health insurance.
Yeah.
Is insane to me. And particularly if you're like, I'm ready to, and there's two places of it. Like, okay, I've always been scared to not having health insurance. And then when I left my group and we were basically buying on the market, we survived, and it was amazingly enough, we did fine, you know, amazing, you know, but, but if you're nearing retirement and you have your, you know, a healthy, you know, be pre-tax, post-tax, maybe you have some whatever in there, but then you're clinging because you're scared. You want to get to Medicare,
which my goodness,
I'm like, this is, it makes no sense to me unless you have some profound health problem. Yeah, that you need really that your current, you know, you need the actual Cadillac healthcare because of, for whatever reason. And even for those, because I always wrestle with that, because you know, if someone has an example of this and wants to email me, absolutely go ahead. It's drkevin@thechangedphysician.com. But even for the things that I'm thinking about, chronic health conditions, focusing on those healthy lifestyle aspects will generally provide you a better return than almost anything else. Yeah, I'm thinking inflammatory disorders. I'm thinking about neuromuscular disorders, you know, cardiovascular disease, all the stuff that I have to kill myself so that I can maintain my health care. But you're actually setting up a situation where you're actually worsening the actual disease process. Makes no sense to me at all. Like none.
The only things I can think about is some strange persistent seizure disorder or something, and usually you can find a generic medication that's reasonably priced in most circumstances like that. But yeah, I agree, everything else is all your lifestyle always helps any condition. Regardless. And it's funny when I think about if I was in that position at that age, or say in 10 years I could retire or something like that, I would direct primary care. It'd probably be my bridge and supplement to Medicare. Like, it would be direct primary care. I will support a physician to not be burned out and enjoy his job. And in fact, I do that with my primary care right now. I don't have to use her. I could have a cheaper option. or not even really, have anything with continuity if I wanted to. But I think, you can design that too. You don't have to be based in fear. There's so many options out there. I'm not saying I'm perfect in my lifestyle, but I will say that I tend to be healthier than the average. I've been very fortunate, but yeah, I think that, you think it's just, what other things you think people are scared of besides like, the whole insurance bit? There's the liability insurance. Some people think it's way more expensive, like in the anesthesia world, than it is.
For
But I pay
part-time?
like part-time is $6,000.
A year?
Yeah.
Wow.
Yeah.
You're in Texas. I don't know what your rates are overall for the nation, but that brings up another thing, in that flexibility of, well, if you're terrified of whatever your liability insurance is, we'll find a place that's better. Unless then we're getting into discussions of tails,
Yeah.
and that's a whole different other
Yeah.
thing.
And that is a fear, because
Yeah.
I've heard things anywhere from like, for part-time to full-time, 15 to 25,000. That's scary, for if they want to come out of a job and create a different life.
Oh yeah, or 50 or 60 or 75,000.
Or that.
Yeah, it's yeah, that's a
No, it's another topic, but I think
Yeah.
I think that layers in like all these like question marks that people have about like changing their situation. I know we're talking about like the dangers of fire, but I guess I'm trying to see how that would layer in there. But
well, the dangers is of focusing like this, because the other thing with liability insurance I can see people be scared of is some companies, if you retire, if you say you're not going to practice medicine in,
oh yes,
then the tail, I don't even know if you
That's
call it a tail,
consequence.
it has significantly less for whatever reason. They're like, well, you're never going to practice medicine again, so then it drops it, which to me makes no sense, because if you're leaving the liability company, they're not liable for when you start another job. I don't know. That doesn't make any sense to me.
Yeah, and it all depends if it's a claims made or an occurrence-based policy, and occurrence.
I don't think there's occurrence. There's hard to get occurrence based.
I have it.
You do?
Mm-hmm.
Oh wow.
Yeah, part-time.
I didn't know they had those anymore. Well, okay, that's awesome.
Yeah, which works for me. Well, when you have to pay a tail and you realize, yeah, that really stinks.
Yeah.
Yeah, but yeah, I don't think they're very common. But yeah, any other thoughts on, I know, we talked about dangers of maybe losing relationships, or your hobbies, or
Health.
your health, especially, because all these things are like insidious. They're things that like don't wave at you in the morning and say, hey, you're going downhill, but it's so slow you can't tell. Like, I feel like this is like a very insidious process, and then even the way you've neurologically wired yourself to always consume every minute of the day of doing things, to feel good about yourself, to feel accomplished, to feel like you're learning more and knowing more, and then trying to downshift gears and to a retirement phase, especially when you don't know how to set up structure in your life, because your work set the structure for you. It created your to-do list. It created your sense of gratification and all those things. You suddenly put on the brakes or downshift, and it can be very unsettling. And so how are you supposed to be happy when you're unsettled all the time?
Well, I would say if someone felt like the way you said, that they're learning and growing and professionally satisfied, then don't retire.
Yeah.
Yeah. But if you're focusing on working so hard simply because you want an X dollar amount, at the cost of everything else,
yes,
that doesn't make a lot of sense. And the hard part of it being, though, is the financial numbers generally have an objective. There's a pretty objective side. You can pick a number that's pretty objective.
Yeah.
But the health and the relationships and your hobbies, that's purely subjective, and those are soft numbers. There isn't like some relationship dial that, and your spouse, see them every day on it, flares up, 51% satisfied, 38% satisfied. There's no, that one you have to be monitoring on. And I would argue, if you get the end and all of a sudden you got your fire number, but you don't have a spouse, or you have a crappy relationship with your spouse, or you don't have kids, or you have a crappy relationship with your kids, or you don't have your health, or and you don't have anything to do that will provide you any sort of sense of meaning in your life, then what actually have you obtained?
Yeah.
That's empty. It's totally empty.
Yeah. They should add an acronym, a little different acronym for the fire, like to right before fire. I'll have to think of it, but financially independent, retire early. There should be another little part about something about satisfaction in other areas of your life too. But I'll have to find that later. Any other last tidbits?
I think that will do it. So I'm going to pull it out because we know there's a lot of searching in medicine and a lot of flailing in medicine, thinking this is horrible and I need to do this. And fire is extremely popular. There's super blogs and podcasts and everybody's money, 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 money. Just remember, there's always a cost with anything. And one of the advantages, again, of being a physician is, yes, we can have really, really high salaries. The other things that you can do is you can find other different opportunities to earn income that provides a very nice lifestyle. Maybe not, you're not jetting around on a private jet, but pretty good lifestyle compared to the rest of the country that you can sustain for a long time and have a wonderful life now. So don't neglect that in the pursuit of, oh, this is the only thing I can do. I have to kill myself for 5 years for a future that doesn't exist yet.
Right. And if you really actually do love medicine and you're just burned out and you can stay in it in some way, I'm sure all of us as patients in the future would love to at least have enough physicians to go around to take care of ourselves.
Happy ones. Yeah.
Happy ones.
Yeah.
So pass on the lessons and messages to the younger generations. But go ahead and take us out there, Kevin.
All right. Well, thank you all for joining us again for another episode of The Changed Physician. And we were talking about the dangers of focusing purely on fire at the expense of those other aspects of your life. And if you are interested in those other aspects, as well as some of that financial info as well, you can join us at thechangedphysician.com. And until next time, stay well.
Take care.